say inclusivity means is about people being able to do what they need and want to do, so having access to the things that everybody else has access to. The NHS is there for everybody, so because it's there for everyone, it needs to make sure it can include everyone and that everyone has access to what it has to offer. I also think, particularly working in a health and social care trust where we work with a lot of people who've got mental health conditions and learning disabilities, some long-term chronic conditions, that sometimes those people particularly experience more barriers. And I think as the NHS, we have to champion inclusivity, not just within the health service, but within social care and within the wider population, breaking down stigma, for example, around some of those kind of very marginalised groups of people. I like everybody to be part of something. I trained initially as an occupational therapist, and we work with trying to help people live their lives however they want to live it, whether that's kind of looking after themselves, working, socialising, learning, developing. And I think to do all of those things, you have to have that inclusivity, really.
Inclusivity and including all carers and service users in all of my work for the NHS is really important to me, because I think everybody should be given equal of opportunity, and that wherever you are, wherever you're from, you've got value to add. And therefore, if I'm able to provide people that opportunity to add their insight and knowledge, then we've got to harness that opportunity. From start to finish, we included a range of carers and professionals in the procurement process, the key bit being the carers. There was carers from a range of different groups, a range of different backgrounds, and with different interests and caring responsibilities. And including them meant that they all got an equal say in how the services was designed and developed and then implemented. So working with a range of individuals in a different way. For example, one of the carers had learning difficulties, so we worked with them with an advocate to ensure that they had a true voice in the process. In the NHS Constitution it says that we're to work with every individual equally and inclusively within all of our work. If you work in a way that means that you exclude a certain group, then obviously they're not going to have their say, so we need to work as openly as possible.
I lead the team in looking into provision of equity of care with the deprived community, and particularly in relation to the gypsies and the traveller community in this part of South Yorkshire. The most important thing we focused on, what's the best outcomes you can achieve in this particular community, and first thing, most important, is engagement and trust. Trust takes time. Trust has to be not lip service, genuinely showing you care. The important thing, as the old saying goes, the mountain doesn't go to the moment, goes to the mountain, or vice versa. We went into the gypsy camps. We went to the traveller community, spoke to the parents, assured them that we are a permanent team in here. We made them understand that we're here to look after the needs and not the other way around. We're here to serve them, and that's what our vocation was, and the whole team. We then provided special training to one of our members of staff to be the traveller gypsy liaison officer. The immunisation was something like about 0% when we came in here about a decade ago. It's now about 72%. That brought on by the trust of the gypsy elders. The NHS is a large organisation, and very often the people at the bottom tend to get forgotten. And it's important that healthcare is centred around their needs. I'm a firm believer, you ask patients what they want, you don't tell patients what they get. I think that's very old-fashioned and it shouldn't exist. And good leadership in the NHS should reflect the patient needs as opposed to what other people think is needed.